Welcome to Psychology Insights Explained, or PIE. Here's a slice of pie. In today's slice, we will dive into cognitive behavioral therapy, which is structured, goal-oriented therapy that helps individuals identify distorted thinking patterns and develop more adaptive behaviors. Have you ever felt overwhelmed by negative thoughts? Like your mind is stuck in a loop, replaying worries and fears? You're not alone. Millions of people struggle with these challenges, but there is hope. It's called cognitive behavioral therapy, or CBT for short. In this video, we'll explore its core principles, practical techniques, and its remarkable ability to transform lives. CBT focuses on the connection between our thoughts, feelings, and behaviors. If we can learn to identify and change negative thought patterns, we can change the way we feel and act. So let's unlock the secrets of your mind and discover the transformative potential of CBT. CBT emerged from the work of several brilliant minds in psychology. The roots of behavioral therapy trace back to the early 20th century. Do you remember hearing about Pavlov's dog, who would salivate when he heard a bell ring? Pavlov's experiments on classical conditioning demonstrated how we learn to associate stimuli with specific responses. The father of behaviorism, John B. Watson, believed our behaviors are largely a product of our environment and past experiences. These early theories provided a foundation for understanding how our experiences shape our behaviors. However, they did not fully account for the role of thoughts and beliefs in influencing our emotional and behavioral responses. This is where the cognitive aspect of CBT comes into play. In the 1960s, psychiatrist Aaron Beck revolutionized psychotherapy with cognitive therapy. Beck observed that negative thoughts and beliefs played a significant role in maintaining depression. He proposed that our thoughts about events, rather than the events themselves, influence our emotional and behavioral responses. Beck's insights led to the development of cognitive therapy, focusing on identifying and changing negative thought patterns. He developed techniques to help patients challenge and reframe their negative thoughts, improving mood and behavior. Beck's work shifted therapy from simply changing behaviors to understanding and modifying underlying thoughts and beliefs, which paved the way for the integration of cognitive and behavioral techniques, leading to cognitive behavioral therapy. Since its inception, CBT has evolved, incorporating insights from various schools of thought. Researchers and clinicians have refined techniques and developed new approaches to address a wider range of mental health concerns. One notable development is the integration of mindfulness-based techniques into CBT. Mindfulness involves paying attention to the present moment without judgment, helping manage anxiety, stress, and emotional reactivity. CBT has also been adapted for different populations, including children, adolescents, couples, and families. It is increasingly used in schools, workplaces, and community centers to promote mental well-being and resilience. And it's this expansion that highlights the versatility and adaptability of CBT in addressing a wide range of challenges. At the heart of CBT lies the cognitive model, a framework for understanding how our thoughts, feelings, and behaviors interact. This model proposes that our thoughts shape our emotional and behavioral responses to events. Imagine receiving an unexpected email from your boss requesting a meeting. Your mind races with thoughts like, "What if I'm in trouble?" These thoughts trigger anxiety and worry, leading to avoidance behaviors. If our thoughts are distorted or negative, they can lead to negative emotions and unhelpful behaviors. Conversely, balanced and realistic thoughts promote emotional well-being and adaptive behaviors. CBT equips us with tools to identify and challenge cognitive distortions, paving the way for more balanced thoughts. Cognitive distortions are mental shortcuts that lead to inaccurate interpretations of events. These thinking traps fuel anxiety, stress, and low mood. One common distortion is all-or-nothing thinking, where we see things in black and white terms. Another is catastrophizing, imagining the worst-case scenario in any situation. CBT helps us identify and challenge these distortions by questioning the evidence supporting our negative thoughts. By recognizing these thinking traps, we can reframe our thoughts in a more balanced way, reducing their emotional impact. Cognitive restructuring is a cornerstone of CBT, providing techniques to challenge and reframe negative thoughts. This process involves identifying automatic thoughts, evaluating their validity, and generating more balanced alternatives. The first step is to become aware of our automatic thoughts. Once identified, we evaluate their accuracy and helpfulness. We might ask, what evidence supports this thought, or is there another way to look at this situation? The final step is to generate more balanced thoughts to replace the negative ones. This shift in thinking can reduce anxiety, boost confidence, and lead to more positive outcomes. While cognitive techniques focus on changing thoughts, behavioral techniques in CBT target actions and behaviors. One powerful technique is behavioral activation, encouraging engagement in activities we used to enjoy. By reintroducing these activities, we can boost mood and break free from cycles of avoidance. Another technique is problem solving, helping us address specific problems contributing to distress. By breaking down problems into manageable steps, we can regain control and make progress. Behavioral techniques empower us to take an active role in our mental health. By changing our behaviors, we create positive ripple effects on our thoughts, feelings, and overall well-being. For anxiety disorders, exposure therapy is an effective behavioral technique. This approach involves gradually confronting feared situations in a safe environment to break free from the cycle of fear and avoidance. Exposure therapy typically involves creating a fear hierarchy, gradually confronting increasingly anxiety-provoking situations. And through repeated exposure, individuals learn to tolerate anxiety and develop a sense of mastery over their fears. Exposure therapy can be a powerful tool for overcoming anxiety and living a fuller life. CBT is an active process that extends into our daily lives. Homework assignments reinforce the skills and techniques learned during therapy. These assignments might include practicing relaxation techniques or engaging in behavioral experiments. By consistently applying these skills, individuals can solidify their learning and experience lasting change. Homework assignments provide valuable feedback to both the individual and the therapist. This collaborative approach ensures therapy is tailored to each individual's unique needs and goals. By actively engaging in homework, individuals can maximize the benefits of CBT and make meaningful progress. Think of CBT homework like a personalized toolkit for your mental well-being. These assignments empower you to put CBT principles into action in your everyday life. Imagine practicing relaxation techniques during your commute or challenging negative thoughts at work. Consistency is key, and regular practice is essential for making lasting changes. Learning through CBT is like learning a musical instrument. The more you practice, the more proficient you become. Don't be afraid to make mistakes. View challenges as opportunities for learning, and be sure to discuss any difficulties with your therapist to tailor the techniques to your needs. Engaging in CBT homework is like going to the gym for your mind. By consistently challenging negative thought patterns and practicing new behaviors, you are rewiring your brain for greater well-being. Each time you identify and challenge a cognitive distortion, you weaken its hold on you. Each time you engage in a positive behavior, you strengthen neural pathways associated with well-being. Over time, these efforts create lasting changes in your thought patterns and behaviors. Be patient with yourself, celebrate successes, and don't be discouraged by setbacks. Always keep practicing and refining your skills to gradually build your mental fitness. Remember, you don't have to go it alone. CBT is a collaborative process, and your therapist is there to guide you. They will provide support, encouragement, and personalized feedback. So communicate openly with your therapist about your progress and challenges. By doing the homework and practicing, you invest in your mental well-being and create a brighter future. One of the remarkable aspects of CBT is its versatility in addressing mental health concerns across different age groups. From children struggling with anxiety to adolescents navigating social pressures to adults facing life transitions, CBT offers tailored approaches to meet unique needs. For children, CBT often incorporates play therapy techniques, using games and activities to help them understand and manage their thoughts, feelings, and behaviors. Therapists might use storytelling, role-playing, or art to engage children in a fun and age-appropriate way. Adolescents, facing the challenges of identity formation and social pressures, can benefit from CBT's focus on challenging negative thought patterns and developing healthy coping mechanisms. Therapists might work with teenagers to identify and reframe negative self-talk, build communication skills, and develop strategies for managing stress and peer pressure. CBT is equally effective in addressing mental health concerns in adults, from anxiety and depression to relationship issues and work-related stress. Therapists tailor their approach to the individual's specific needs and goals, helping them develop coping skills, challenge unhelpful thought patterns, and make positive changes in their lives. Cognitive behavioral therapy's effectiveness has transcended geographical boundaries and cultural differences, making it a truly global approach to mental well-being. While CBT originated in Western cultures, its core principles have resonated with people from diverse backgrounds, leading to its adaptation and implementation worldwide. Researchers and clinicians have made significant strides in adapting CBT to be culturally sensitive and relevant to different populations. This involves understanding the cultural context of mental health beliefs, values, and practices, and tailoring the therapy approach accordingly. For example, in some cultures, expressing emotions openly might not be the norm. In such cases, CBT therapists might adapt their approach to focus on behavioral activation or problem-solving techniques that align with the individual's cultural values. The global reach of CBT highlights its universality in addressing the human experience of thoughts, feelings, and behaviors. It underscores the power of this approach to empower individuals from all walks of life to improve their mental well-being. While CBT is widely recognized for its effectiveness in traditional therapy settings, its applications extend far beyond the therapist's office. CBT principles and techniques are increasingly being integrated into various aspects of daily life, promoting mental well-being in schools, workplaces, and communities. In schools, CBT-based programs are being implemented to help students develop emotional regulation skills, manage stress and anxiety, and improve social-emotional learning. These programs equip students with valuable life skills that contribute to their academic success, personal growth, and overall well-being. Workplaces are also recognizing the benefits of CBT in promoting employee mental health and productivity. Companies are implementing stress management workshops, mindfulness programs, and resilience training based on CBT principles, creating a more supportive and mentally healthy work environment. Furthermore, CBT is being utilized in community settings to address a wide range of challenges, from substance abuse and criminal justice reform to promoting healthy aging and caregiver support. These initiatives demonstrate the adaptability and effectiveness of CBT in addressing real-world issues and improving lives on a broader scale. We've covered a lot of ground in this video, exploring the core principles and practical applications of CBT. From understanding the cognitive model to challenging negative thoughts and embracing behavioral techniques, CBT offers a powerful toolkit for transforming our relationship with our thoughts, feelings, and behaviors. Remember, CBT is not a magic bullet or a quick fix. It requires effort, commitment, and consistent practice, but the rewards are well worth the journey. By actively engaging in the process, you can develop greater self-awareness, build resilience, and cultivate a more positive and fulfilling life. If you're ready to embark on this journey of self-discovery and growth, reach out to a qualified mental health professional. They can provide you with personalized guidance, support, and evidence-based strategies to help you achieve your mental health goals. CBT empowers you to become the author of your own story, to rewrite negative narratives, and to create a brighter, more hopeful future for yourself. So embrace the power of CBT and unlock your potential for lasting well-being. Thanks for joining us today for this exploration of cognitive behavioral therapy. Be sure to like this video and subscribe to our channel for more mental health insights. And don't forget to share this video with anyone who might benefit from learning about CBT. Together, we can make a difference. Until next time, this is Psychology Insights Explained.